Hello everyone, this is Stacy Fox from TAC. Thanks for joining us today. This is the third session of the 811 PRA Grantee Startup Training. Today we're going to focus on startup activities, and after this session we'll have one session left. So just a few quick reminders about today. You can ask questions by using the questions box that you see on your screen right now. You can also feel free to ask verbal questions. You just have to make sure that your audio pin is entered, and you can do that by pressing pound, your audio pin number, pound again on your phone's keypad. And then whenever you would like to speak, you can just use that raise your hand function, which you're seeing on the screen right now, and I'll know to unmute you. We're going to cover a lot of material again today, but we will have time for questions. So after certain sections, we'll stop to take a few questions, and then we'll also have time at the end of today's session to cover additional questions. Today's session is being recorded, and you're going to receive a link to the recording as well as a copy of the slides following the webinar today. You'll get it tomorrow. And we're also working to get these recordings posted on the 811 PRA mini site on the HUD Exchange. So the slide that you're seeing on your screen right now, you've seen before. It lists the key contacts for this program. With us today from HUD, we have Danielle Garcia, Marvis Hayward, Katina Washington, and from TAC, I'm joined with Lisa Sloan. So I can see that today we have participation from Alaska, Arizona, California, Colorado, Connecticut, DC, Georgia, Illinois, Kentucky, Maine, Maryland, Massachusetts, Michigan, Minnesota, New Hampshire, New Jersey, New Mexico, Nevada, Ohio, Oregon, Pennsylvania, Rhode Island, South Dakota, Texas, and Wisconsin. So I'm going to turn things over now to Katina Washington, who's going to talk to you about today's agenda. Katina?
Thank you, Stacy. Welcome to the third multifamily series of the startup webinar for the section 2013, for the section 811 for the FY13 grantees. We hope that you've been finding these series very helpful. Today we're going to cover some of the startup activities you should be engaged in right now to get your program off to a great start. In this session, we have something a little different for you guys. I hope you find this series helpful in getting you started. Some of the topics we're going to cover today are unit identification and selection, collaboration with partners, outreach and referral systems, as well as HUD systems. For the unit and selection identification, you will hear from the FY12 grantees about their approaches to the unit selection and identification and how they're collaborating with their state human services and Medicaid partners to ensure that the unit selected for the program will be desired by the target population. We'll also talk with the FY12 grantees about their outreach and referral. And you'll learn some information about HUD's requirements for the Affirmative Fair Housing Marketing Plan. You will also hear, last but not least, we will also hear about the HUD systems that are specific to the PRA program. Most of the grantees are either PBCAs or TCAs, so you already know about these systems already. For those of you who are less familiar, don't worry about it. We'll have more of a comprehensive orientation later about the HUD systems. Now I'm going to turn it over to Lisa Sloan from TAC, who's going to discuss the unit identification and selection, and a little later Lisa will also discuss the collaboration with partners.
Thanks, Katina. Hi, everybody. As Katina just outlined, the first activity we'll talk about today is how grantees yourselves will identify and then select from among the eligible multifamily properties that you've identified for your program. Slide 7 illustrates the most common unit identification strategies that the FY12 grantees have been using. A number of states have used the Notice of Funding Availability, NOFA, otherwise known as a NOFA, or Request for Proposals, RFP, a competition to identify units for their PRA programs. These NOFAs have been, in some cases, very expansive, as you're going to hear from Christina in California shortly, and some have been more modest, such as those used by Washington State and other states. The second strategy that grantees have used is to create a pipeline by selecting units from their low-income housing tax credit or home pipeline. For example, grantees have included various requirements and incentives in their quality allocation plans, also known as QAPs. Some grantees, Louisiana, Pennsylvania, Maryland, for example, have included, or Louisiana and Pennsylvania, for example, have included threshold requirements in some of their tax credit QAPs, some years. Pennsylvania is going to talk about their QAP shortly. Other QAPs have included incentives such as extra points for applicants who agree to set aside PRA, units for PRA. I believe Maryland is in that category. Some of these QAPs have been very specific, for example, targeting the PRA program, whereas others have provided points for permit-supported housing but not specifically mentioned PRA, and others, again, have targeted extremely low-income households, including but not limited to those eligible for permit-supported housing. There are as many creative ideas as there are QAPs. The third strategy that many grantees are using are face-to-face developer meetings. These include both one-on-one meetings, for example, with a developer who is known to be interested in serving vulnerable populations or who is considered a leader or trendsetter in the local developer organization, as well as group meetings. You're going to hear shortly from the FY12 grantees about a variety of these kinds of developer meetings and how they've been used. Next slide, please. There is no one right way to identify units. We suspect that you will likely have to use multiple methods and perhaps different methods at different times to be successful in selecting the number of units that you need for your program. In designing or selecting from among these strategies or prioritizing which ones you're going to use, you might want to consider the following. What did you propose in your application? Are you doing existing housing only or new construction or both, and what's the ratio? What's your housing market like, or what is the market like in the locations that you would like to use primarily? What kind of mechanisms are already in place? Some of you probably have a QAP pipeline that is already providing PSH units. Are there other policy objectives in your QAP or your con plan that are kind of competing, or is there room this year or next to provide some significant points for permit-supported housing? How has your state produced permit-supported housing in the past, and have these strategies been successful? Those are just some of the factors that you might want to start thinking about in terms of developing or prioritizing your strategies. We recommend that you develop or update an initial plan for your unit identification. You will want the plan to include timeframes and benchmarks. Without these, it will be hard for you to internally, in your group, determine whether your strategy is working effectively or you need to make mid-course corrections. We would encourage you to evaluate the plan against your benchmarks regularly and make those changes as needed. Again, this is not developing a plan is not a program requirement, but we think it's a kind of a best practice that will help you along your way in terms of identifying units. Hopefully, as we turn to unit selection, hopefully your unit identification process, through that process, identified a number of different eligible multifamily properties. You may not like all these properties, or there may be pros and cons to them, so you need to go through kind of a selection process. We hope that you'll have that opportunity. You may, through this process, decide to select all the properties that you've identified, or you may decide to select only some. In addition to not overcommitting your rental assistance award, this slide and the next outline some issues to consider in this unit selection process. For example, when you want to consider whether the property meets the definition of eligible property that is contained in the NOFA and your cooperative agreement, and the guidelines, such as being 5 or more units, and whether the proposed rent is within the maximum allowed for the initial rent level. In addition, in your application to HUD, you may have made some leveraging commitments around the rent, such as providing a certain percentage of units to the program at a rent below fair market rent, such as 30% of AMI. You'll want to be sure your selection process will help you achieve this commitment. Finally, if you're lucky enough to have many units to select from, you may have other selection criteria you want to apply, such as selecting owners or property managers who have more familiarity with HUD's online systems, such as TRACS. You'll be hearing about those in a little while. Most importantly, you'll need to ensure the units you select will be filled in a timely manner by persons in your target population as defined in your application and your interagency partnership agreement. The units have to be desirable to that population. They have to work for them. And this is where your relationship with your state service partners is critical. They'll have insight into the variables that make units desirable and easier to lease up. This is the first area, perhaps, where your partnership is critical. You can hold your partners accountable only if you allow them to help define which units are going to work for the target population. Variables that the Center for Medicaid, Medicare Services, and state human service agencies have indicated through both the FY12 program and other programs serving non-elderly people with disabilities are important to consider include location. As you know, in this business, it's all about location, location, location. Unit size. That is your target population, and some of this would have been reflected in your application. Your target population need a lot of ones. Do people have personal care attendants? Do you need some 2-bedrooms? What about accessibility? What percentage of the target population needs an accessible or an adaptable unit? So, and how many of each of these types are needed? In thinking about, many of there are other features. The same kinds of features that make developments are things that you select for the tax credit program, for example, that you think are important, such as access to public transportation. But you've got to think about those variables. It is really critical to include your partners. We have seen it's important to include your partners. Beforehand, your partners can help inform you of the needs, as we've just discussed. How many accessible units, what size, and how many in which kinds of locations. And once they've been identified, they can help participate. Once you've identified your pool, they can help participate in the review. We've seen in the FY12 states that service partners have been happy to go out and look at sites in order to be able to provide a more robust response to your request for information. They really want to go out and they want to check where that bus station is located in relation to that multifamily development. So let's continue to talk a little bit about this collaboration issue. We know that some of you already have strong state-level housing and service partnerships in place, so you're not going to be surprised at our recommendations for collaboration. First, I want to say that this is a good time to start to clarify roles and responsibilities. Your interagency partnership agreement probably includes a description of these. Now is a good time to review the partnership agreement together and determine if it's still accurate or requires some additional documentation. The application you submitted the application over a year ago, and some things may have changed. As you've discussed with your TAC TA leads, the partnership agreement becomes part of the cooperative agreement. It's an exhibit. So if there's anything you want to update and include, now is a good time to think about doing that. Second, as in all collaborations, it's very important to ensure effective communication. Creating a regular schedule of calls or in-person meetings with your team is one of the best ways to ensure that this happens. We were wondering if you've held a startup meeting yet with your partners. In addition to celebrating your success in securing these funds for your state, a startup meeting is a good time to take stock of the agreement, to review goals, roles and responsibilities, and to introduce any new players to the process and to the program. We encourage you to use HUD and TAC to help you with this collaboration process. If this was easy, we know we'd all be doing it. We know it takes a lot of work. So with that said, we'd like to turn to hear from the experience. I think what you all really want to hear is from our FY12 grantees about their experience with unit identification and the selection processes they've been implementing. First up is Holly Glauser. An attorney, Holly's the Director of Director of Development at Pennsylvania Housing Finance Agency. Holly, thank you for joining us today. We were hoping you could tell us a little bit about the multiple strategies that PHFA is using to identify units. We think you've done some stuff with your QAP, developer meetings, maybe even RFP.
Thank you very much, Lisa, and I appreciate the time right now. It's really interesting to me because as you were going through your slide presentation, rewinding the clock, if we had something like this 2 years ago, I think we'd be in a great position now. So I think the new group is really fortunate even to have this presentation and the technical assistance moving forward. We have really taken a multi-pronged approach over a number of years trying to serve persons with disabilities. And I think one of the places we started with is our qualified allocation plan. Over the last 10 years, the agency has incentivized the development, new developments to encourage specific housing goals for persons with disabilities. And we've done it in a couple of ways. The first goes back a number of years that we identified one of the struggles in housing this population is really affordability. So 10% of our units were mandated to be affordable to persons 20% of area median income. And for us, that has been a goal. It's been in our qualified allocation plan for a number of years. With that 20%, the 10% of the number of units, half of them have to be accessible, with the other half just having the affordability restriction. And moving forward, this really gave us a very good pipeline when we sent in our application 2 years ago, or 3 years ago, for the PRA 811 program. So it is a mandatory requirement, it is a threshold criteria, and it has been in place for a number of years. The second way that we really thought that we were encouraging supportive housing is we, a number of years ago, incentivized the supportive housing set-aside. So again, going back 3 to 4 years ago, we had that in our QAP. So where does that bring us today, and where does it help us with our unit selection? When we sent in our proposal into HUD in 2012, we anticipated that we would be utilizing the PRA assistance, the Section 811 assistance into existing tax credit projects. And we structured the program based on what I would call the pipeline. And we've been now looking at the pipeline as projects are being placed in service. And look at it, and I think that slide 7 you showed earlier, Lisa, is really that multi-prong approach. With this being a new program, there is skepticism to managers on what participation means, what the assistance looks like to them, and also timing. And having a ready available group coming in the door really has made it successful for us because we have been talking about it, I think, at every single meeting that's available us to do. So whether it's at a qualified QAP meeting of interest, or whether it's one-on-one with the owners, and also we were one of the, we did just outreach in, I call them convenings, on a regional basis. I'm happy to report, and I think Steve Chopek's going to talk about it a little bit later, in doing our assessment of units that would be eligible, we looked at what the requirements of the NOFA, the 811 NOFA, and the cooperative agreement, and we are setting strategies and priorities to fill those that meet most of the requirements. For example, existing developments, projects that already have other HUD housing assistance in them, managers that are already invested in the utilizing the track system. So our priorities in rolling this out is really to engage those owners that we think that can come online quicker, and that would also provide us with test cases or role models to make this successful. We also have engaged many meetings with our DHS agency under what we're calling a local lead agency model, working with local service providers to refer prospective tenants into those units. And I'm very pleased to announce, and I believe Steve Chopek is also on the line, we are in place right now with our first property that was an existing tax credit project in a county that has a local lead agency that is engaged and has the capacity to be writing our first rental assistance contract. It takes some work I think going back and really looking at the pipeline and looking at what's existing and then what's prospective is really key. And really educating and doing the one-on-one is very important with the owners and also your partners, the local lead agencies and service providers, to get them engaged. It's not a one-time conversation. We have found that it takes multiple conversations, both whether it be a webinar or a convening or just direct reach and outreach to get folks engaged. But we're really excited to be at the stage right now where we did, out of our first 200 units, we did a limited notice of funding availability for 50 units. And we have engaged owners wanting to fill those units in multiple locations throughout the Commonwealth. So we're now working with the specific properties, the size of the units, and also the local lead agencies and service providers to get them engaged.
That's great, Holly. Congratulations on your success and your first graph, which I think sounds like it's headed to HUD pretty soon. It's exciting. It's great. Thank you very much, and we'll have questions in a few minutes. If you can say that long, great, and if not, I know Steve's on the line. Again, thanks. So up next would be Elaine Cornick, and I believe she's accompanied by Shalonda Manuel, and they're going to talk a little bit about what they've been doing in Maryland and how it's working for them.
Good afternoon. I'm very happy to be on the call. I think Holly has talked about a lot of things, and that we do a lot of things in the same manner. We've been working a long time on trying to figure out how we provide housing for persons with disabilities. And like Pennsylvania, Maryland had started putting things in our QAP and guide back to 2002, where people were able to start gaining points if they were willing to commit units for persons with disabilities. And through the years, it has become more strategic. We've reduced the income of the tenants, and with the ability for 811, we were able to provide the rental assistance that's really necessary. Maryland doesn't have a state rental assistance specifically for persons with disabilities funded rental assistance program, so 811 was very, very important. We meet, and in part of that, in preparing for the 811, the first 811 application, Maryland, our Department of Health and Mental Hygiene, the Department of Disabilities, which you'll hear from John Brennan later, and a group of stakeholders began meeting prior to even the first application, trying to develop our communication and collaboration. And that went on for more than a year, and it really served us well. We meet now at least monthly as an interagency group, and we meet quarterly with all of our stakeholders, which includes people with disabilities, people from the community, other service providers, all the state agencies, and additional state agencies that are not part of the our agreement. We also made agency, the elderly aging department is included in that. We also have developers on that group. So it's pretty extensive. We try to touch base with everyone and make sure that everyone's on board. Right now, the QAP does allow for points, first, if they are willing to set aside up to 25% of their units for persons with disabilities, and they must take those units through our referral system that John will talk about. And in addition, they can receive more points should they be willing to take 811 units. The first round, we restricted the 811 to our more central counties and jurisdictions. And with this second award, we were able to offer the unit statewide. A lot of developers were interested in that, and a lot of people that have already signed up into our system are also looking to move, not just in the central locations. And so we have, from the first round from the first and second round, we've been able to offer 811 with 2 rounds of financing now, and we have 87 units signed up in a pipeline. One is under construction, and they are getting ready to start working with John Brennan and his group for lease-up shortly, and then we'll be closing on more units in the next couple of months. We haven't had the ability to be able to start working with someone for an existing property yet. We're trying very hard, but we can talk about that. Thanks.
I almost hit the wrong button here. Sorry. Thanks so much, Elaine. And we're going to hear from, in a little while, from the Pennsylvania and the Maryland service partners, John Brennan and Steve Chopek, who are on. We'll introduce them in a second. Thanks, Elaine, and Shalanda, thank you for your time. Before I introduce Christina DiFrancesca, I want to say that if you start to have questions, please use the chat box to put your questions in, and we will pull them up as they come up. So next, Christina DiFrancesco is with California Housing Community Development Agency. California, they have 4 different housing agencies, and Christina has somehow managed to get them all together to get this application in and the program rolling. And I think they've developed a very comprehensive NOFA, which they're willing to share with you all, and I think Christina's going to talk about it with us today. Thank you, Christina.
Sure. So as Lisa mentioned, California is a very big state, and so we had to pull together a lot of partners in order to submit a competitive application under HUD's funding parameters. We started collaborating in 2012. We have our lead agency, which is our Section 8 project-based administrator. And then we have our LIHTC agency. And then my agency, which is the agency that has the most different types of development programs in the state. That's on the housing side. And then on the service side, we have our Medi-Cal agency and their sister agency that works just with folks with developmental disabilities. So 5 agencies in all, 3 housing agencies and 2 service agencies. Our target population is people coming out of skilled nursing facilities and other facilities where they've stayed at least 90 days, and Medi-Cal has paid for at least one of those days, as well as developmentally disabled folks who are at risk of going into those types of institutions because they lack stable housing with support services. So in the realm of target population compared to other states, we are more narrow, at least in this first round, focusing on kind of the typical MFP type population. Because this program is so different from the typical Section 811 capital program that HUD has operated in the past. In our initial outreach with developers, we weren't quite sure how much interest we could get in the program early on. So we made a decision early on to have an over-the-counter process whereby we would recruit projects and fund them as they were ready to go. With our MFP program, the way it is currently structured, DHCS, our Medi-Cal agency, contracts with MAP service providers in each county, and they have several in each county. So both on the housing side of the agencies that develop the housing projects and on the service side in terms of finding these tenants, we are very decentralized at this point. One of the things we wanted to do to try to improve that centralization at the local level was to really emphasize the partnership between the developer and the CCT provider, the MFP provider, we call it CCT in California, so that they could begin building those infrastructures, if you will, specifically targeted to the MFP population locally. So we put together an over-the-counter NOFA that basically took HUD's requirements, put them into a NOFA and an application form that was very easy for folks to fill out. But we did, number one, require that the developer, the property owner, and the MFP provider partner together when they submit the application. Because as you know, in reviewing HUD's NOFA, there are certain pieces that are the responsibility of the service agency and certain pieces that are the responsibility of the owner. So we said, if you want to come in for this 811 property owner, you must first partner with our service providers, just as we had to partner with Medi-Cal in applying to HUD. And we've done a lot to facilitate those partnerships. We have a sample MOU that we've already developed, which lays out the roles and responsibilities of each, and ask them very specific questions about how their tenant referral process is going to go. For example, how many consumers does the MFP provider or the provider of services to developmentally disabled have to refer to each property owner for every unit the property owner has available. Kinds of very specific things, get them to commit to up front. And we also have a sample tenant selection plan that also memorializes those kinds of processes and procedures at the ground level for the tenants. So that has worked out well because it's given them the products they need to really think about how they work together and how they formalize their relationship. We have initial meetings or phone calls with developers and the service partners to bring them together, to get them talking about what properties they have available and what the service needs of the consumers in their area are, so that that partnership is fostered by our involvement. For affirmative marketing, for example, that is solely on the shoulders of the tenant referral organizations, the MFP providers and the DD providers. And so we worked out a process for them to do that affirmative marketing, and we've got that memorialized in a very simple form where we supply the data and help them do that analysis. So what happens in our application review process, and we funded 3 projects to date, and we are just about ready to fund our 4th, is we have a collaborative application review process. So each of our state partner agencies takes a piece of the application that they have the most expertise with. So here at HCD, for us, it's the federal overlay compliance. Since most of the projects, 99% are funded by our tax credit agency, if there's anything specific to the rent structure or the site suitability or any building issues, our tax credit agency takes the lead on reviewing that in the initial application, those kinds of things. So we divide it up by expertise, and we each review a piece of the application, and then we get together every 2 weeks to discuss our review, figure out what's missing, what we have questions about, et cetera, and then we get together again with our developer, property owner, service provider partners, and we go over, what we're thinking about the project, how we think the process could work better, if there's some bumps that they haven't thought about, etc. And so that communication among the state team and among the locals is pretty consistent and happens very quickly, so that we were able to move at this point from application stage to award stage in about 6 weeks. So it's a fairly fast process, and our Section 8 provider, our contract provider, is very quick in their process in terms of getting the recs executed, etc. So that's been working well. And I would just say, we're joined at the hip from now until the end of our obligation under the recs. And so that's just how it's going to be, I think. And I think that's a really good thing, because I think it forces us to look at the needs of this target population and really focus on what their needs are. Is there any other questions I haven't answered? Oh, one thing I wanted, I'm sorry.
Somebody wanted to know what is the over-the-counter NOFA?
So it basically means it's not competitive. A property comes in and a service provider come in when they're ready to get funded. There's not a set deadline where all of the properties have to apply. So it's rolling. One thing that I've noticed, because of the 25% restriction on persons with disabilities in the building, it has forced us to do a smaller number of units per project, which means that we've had to recruit more property owners than we initially thought we'd have to recruit to get to our target number, which I think at this point is like 283 or something like that. It's not necessarily a bad thing, but it does mean we have to do more outreach. And we do outreach in a lot of the ways that folks have already mentioned from Pennsylvania and Maryland. We don't have incentives in our QAP. That's not something that our tax credit agency wanted to do because the target population is narrower, and they didn't want to, in a very competitive program, give the impression to other developers that we weren't broadly serving every person that needed rental housing in the state. So we are trying to build incentives into our own funding programs here at HCD, and in order to emphasize PRA 811 in particular, and I think that is having some success, although to counterbalance that, we have a very strong desire to serve more than 25% disabled in our projects by regulatory restriction, and that's a historical decision made by our agencies and our stakeholders. And so finding that project that is only 25% or less than 25% so that we can layer on the PRA, is, I think, key to us really being able to successfully recruit developers. And so far, we've got 77 units essentially funded at this point, and we've got probably another 30 or 40 in the pipeline at this point. So we are having success. It just takes persistence and elbow grease, and we're willing to do that.
Great. Thank you, Christina. It sounds like I think all the presentations have been really interesting and helpful, and there are some themes across those. We, in addition to the over-the-counter NOFA question, I want to say we have a couple of questions that I'm going to hold until the next section because they're really about sort of tenant selection topics. But we do have a question, the following. How have states covered the cost of rehabbing for accommodations? Have folks used money follow the person money or other funds? Do you each want to address that real quickly? and if you've done it already, you may not have gotten to that point, or how you plan to create modifications as needed.
You want me to jump in, California? Sure. We're using the MFP money for units in the building that aren't already accessible.
Okay. How about Maryland? What are you guys doing?
We haven't run across that question yet. So in all of the projects so far we've been doing are new construction.
Okay. And somebody wants, oh, I'm sorry, Pennsylvania. Steve, do you want to answer that question?
Yeah, we haven't run across that yet either.
Okay. How about vacancy claims or vacancy allowances, which is an option in the program but not a requirement? Have your somebody wants to know about your programs if you are using, just allowing vacancy payments or not.
This is Maryland, and we will allow, following the regular Section 8 requirements.
How about Steve?
Yes, Pennsylvania will allow vacancy payments as well.
And California?
Yes, we will. And the other thing that is kind of related to that is if there's been a gap in time between when the spigot can turn on at HUD and when the folks are ready to move in, MFP will also pay up to 2 months rent through their program before the spigot can be turned on.
Kind of like a mini bridge?
Yeah.
Okay, great. Someone asked, and this is I think specific to Pennsylvania, or at least the question was asked in the beginning. Steve, do you know, does your QAP have your QAP has a permit-supported housing set aside in addition to the target to the people who are extremely low income, is that correct?
That's correct, yes.
Okay, thank you. Okay, I think we'll move on to the next section. Remember, we're going to have some questions after this section, and I'm going to hold those 2 tenant selection questions till then, and then at the end there'll be an opportunity for additional questions, so keep them coming.
Thank you, Lisa. Now we're going to talk about outreach and referral systems. We got to hear about the housing side of this program. The activities are for most of you, the responsibility of your state service partners and perhaps the regional and local partners. We're going to talk about the outreach in this section, the waiting list management, and referral systems. Again, we're going to look into some of our FY12 grantees' experiences, but we'll start with a bit of information about the Affirmative Fair Housing Marketing Plan that you all will be required to develop and submit to HUD, and we'll discuss in more detail with you at the convening. In this section, we're going to talk about what is the Affirmative Fair Housing Marketing Plan. As well, we're going to take a look at the HUD Form 92243, which is the plan itself. We're also going to discuss what needs to be submitted to HUD for approval before you start your outreach. And we're also going to talk about the responsibility, even if the outreach is delegated. It is the policy of the department to administer its housing programs affirmatively as to achieve a condition in which individuals of similar income levels in the same housing marketing area have a like range of housing choices available to them regardless of their race, color, national origin, religion, sex, disability, or familial status. Each Section 811 PRA program grantee shall comply with the Affirmative Fair Housing outreach requirements in soliciting applicants for this program. For the Section 811 PRA program, compliance with Affirmative Fair Housing outreach requirements is the responsibility of the grantee. If the grantee delegates its outreach activities to another entity, the grantee is responsible for ensuring that entity complies with the with the Affirmative Fair Housing outreach requirements. Affirmative Fair Housing outreach activities include, but are not limited to, the methods of advertising and community outreach that are designed to reach eligible persons in the target population who are at least likely to apply for the program. Grantees must conduct advertising and outreach in formats that are accessible for persons with disabilities and that ensure meaningful access for persons with limited English proficiency, otherwise known as LEP. For persons with LEP, this may include conducting advertising and outreach in languages other than English. So when I talk about least likely to apply, that means that there is an identifiable presence of eligible persons of a specific demographic group, which means either race, color, national origin, religion, sex, disability, or familial status in the target population, but the members of the group are not likely to apply for the housing in the absence of special outreach efforts. Special outreach may include activities the grantee is already engaged in. Now we're going to take a look at the form 92243. And you should see this on the slide. You'll be required to submit this part of your plan. We are in a process of processing and updating instructions to the form, and once we receive approval, the form will be available for your use. The forms will be available on the HUD Exchange and in HUD Clips. Now let's discuss a little bit what should be included in your plan. The program will be non-discriminatory in outreach and other activities. It also should describe how the least likely to apply will be reached. Persons either with communication disabilities also need to be included when you're thinking about your outreach, as well as the limited English proficiency. And each of these plans need to be submitted to HUD for approval. I just want to re-emphasize that. Now we turn over to the resources that would need to be for your marketing plan, as well as you'll have the form itself, the instructions for your use, and the FAQs, which will be a reference for you in completing your form. And we'll also have additional information at the convening. And we also don't forget your TA lead will be assistance to you in helping you complete your marketing plan. Now I'm going to discuss the tenant selection plan. Now, grantees have to remember that your tenant selection plan needs to be in place before tenants are selected for your program. The tenant selection for the PRA is generally conducted either at the state or county level, so a TSP is needed for the program. The owner screens the PRA tenants but does not select, and the grantee TSP is not submitted to HUD, but it should be available for us on site and in your files. So your marketing and outreach activities are closely related and even part of your tenant selection plan. And just remember that you don't actually need to see your plan, but you need to have it available and on file for any site visits or monitoring. When developing your TSP plan, we suggest that you visit your, the HUD Handbook 4350.3, especially look at Figure 4.2, and this will give you guidance in how to develop your TSP. Just remember, this is your TSP is going to be at the state level, and in the 4350.3, it discussed more of the on the owner level. So when you take a look at that, just keep that in mind. So in the next slide, we're gonna take a look at the page on 4350.3. This is Figure 4.2, and this is some of the topics that are included in your tenant selection plan. And we recommend this as using this as an outline to begin your TSP. Not every topic in the outline will be relevant to your program, but most will be, and will help you think about and think through the policy issues you will want to address, such as over and under occupancy. So let's talk about some of the examples that you might have in your TSP. You can have your owner screening criteria as the addendum to your grantee TSP. your owner's TSP references to the grantee's TSP. If your owner has cap preference for people with disabilities, the PSH unit would be a component of the preference and would limit the number that could be selected by the owner for remaining units. So these are how the PRA program and the owner TSPs would relate. And those were just some examples that I went over. Now we're going to move over to speaking about outreach, and I'm going to turn it over to Marvis.
Thanks, Katina. So let's take a step back and look at outreach from a practical administrative perspective for a minute. As in other subsidy programs, the outreach timeframes are very important. In determining how your service partners know when to begin outreach, they need to know the answers to the questions that are shown here on the slide. And as you can see, the questions is, when are the units expected to be available for occupancy? Does the property manager want to receive the application? When does the service partner start outreach to identify eligible persons in the target population interested in the location? And how many referrals per unit or location will be available? The grantees and their state partners should start to answer these questions and map out time frames for the outreach process. And here you'll see an example to the questions that were just raised. When are units expected to be available? Units will be available for occupancy March 2016. Also, the property manager wants the applications by January 1, 2016. So therefore, based on that, the outreach should begin October of 2015. And the affirmative fair housing marketing plan should then be completed by September 30th, 2015. Okay, let's talk for a few minutes about the grantees waiting list management and referral system. As you think about these systems, there are some high-level characteristics that they typically have. First of all, systems generally are centralized at the state, but some are decentralized and managed at regional or local level. And we heard some of that from our state grantees who spoke a little while ago, but we'll hear some more about that shortly. And then secondly, a range of agencies administer these systems. In some states, it's the State Housing Agency, and in some states, the Services Agency, and then in some others, it's the State Disability Organization. And then the same variety can also be found if it is a decentralized system. And so some things to take under consideration when developing this is that many of you have probably already determined your waiting list management system design. And some things that you might want to think about if you haven't done so already, design that waiting list system, or if you're just doing a check-in on your current system, is what you want your system to do for you. Is it going to be used to just manage your waiting list, or to match potential tenants with available units, or to assist in your program administration or through reporting? And secondly, the costs that are associated with this. When you look at the systems, consider both the upfront and the ongoing cost of a system, and don't forget to include the cost of using your own agency or staff, which is a legitimate cost. Thirdly, you should consider the capacity of your current staff. Is your staff already maxed out, or can they take on the responsibility to handle this additional program? Another consideration is, do they have the skills that may be needed to manage the system? And then finally, excuse me, how many referrals do you anticipate? If you have a small program, perhaps an expensive or complicated database is not necessary, and you can do a lot of the work on your own. But if you have a larger system, or if you expect hundreds of applicants or more over time, then perhaps a more sophisticated database will save you a lot of time. Okay, this slide provides some examples of systems being used by our current grantees, including some proprietary systems and also some do-it-yourself or DIY. Grantees who have contracted or purchased proprietary software include Yardi, SocialServe, and some others are using some service bureau systems. And states are also using Excel and Access databases that they develop for themselves. So at this point, I'm going to turn it back over to Lisa, and she'll be covering lessons learned.
Thank you, Marva. So we're pleased to have two states to talk with us today about their waiting, two of the FY12 grantees to talk about their waiting list management systems. John Brennan, the Chief of Staff at the Maryland Department of Disabilities, is here, and Maryland uses a centralized system. And Pennsylvania, Steve Chopek from the Pennsylvania Housing Finance Agency is here, and they have a decentralized system of local lead agencies in most of their 67 counties. And if you think back to the slide that Marvis was talking about, those local lead agencies include a variety of housing, services, disabilities, and anti-poverty agencies, and I'm sure that he's going to be talking about this a little bit. So, John, would you like to start, and then Steve chime in after that?
Sure. As Lisa said, my name is John Brennan. I'm with the Maryland Department of Disabilities, and thank you for the opportunity to talk today about what we've put together and what we've learned. I hope the information that I'm able to provide is useful for you. I'm going to try to keep it to 5 minutes, so if you have any if you want any more detailed information after this call is over, my email is up there. Feel free to contact me, and we can provide you with as much information as you might like. As Elaine and others have talked about throughout the presentations, our effort in Maryland is built upon a strong network of partnerships. There are a number of people or agencies that have been involved in this effort for quite some time, long before we actually applied for the 811, first round of 811 funding. From the state end, it's three agencies. It's the Department of Housing and Community Development, the Department of Health and Mental Hygiene, and then my department, which is the Department of Disabilities. And we each have sort of specific but interrelated roles that help make the whole process work. And also, we all took part in identifying what type of system we wanted and what we wanted it to accomplish. So as you probably already gathered, DHCD is primarily responsible for reaching out to developers and funds the units and make sure that rent subsidies are paid and ensures housing quality standards are in compliance with the HUD program. DHMH, Department of Health and Mental Hygiene, is made up of numerous agencies that basically provide the funding for the voluntary support services that our applicants are taking advantage of. And our role as MDOD is to manage our web-based eligibility system, the tenant selection and referral process, and then to track unit availability. We, as Lisa said, chose to have a centralized system that was secure and available online, and to also help us screen for eligibility. And so when we looked at what we wanted to accomplish with our system, the first thing that we started with is to really look at how is the applicant process going to work, how does that match with what the needs of developers and property managers are, and then we kind of built our referral system around timelines that we thought would be reasonable for the referral process in terms of the amount of time that it would take from the point that we get a referral from an agency to the point that they get into the unit. And so as far as our applicant process goes, it really starts with outreach and education. In our system, we've prioritized certain populations. Those populations are all served by supports planning agencies and case managers that are linked to the agencies within DHMH. And so we've primarily done our initial outreach to those supports planners to let them know about the program, to describe what they need to do in order to apply for the program, and then make sure that once they get the person into the program that they know what they need to do while the person is in the wait list process. So the first thing that a case manager or supports planner would do would be to contact us or the provider of our system to get a username or login. That enables them to fill out information, and they're able to refer an applicant. Our system is closed in the sense that we only allow individuals from case management or supports planning agencies, basically the agencies that are providing the long-term supports for these Medicaid-eligible applicants, to make a referral to our system. So once they get their user ID and password, they can refer that. We, in our system, have hired one full-time permanent housing wait list manager who basically has three functions. One is to go through the screening, the preliminary screening process that the system engages in, and then they review that and mark the person as approved waiting, which means they're on our waiting list. So they manage the wait list, they look at the selection process, and then they provide technical assistance to the case managers, property managers, and owners throughout the process. So once someone, our system pre-screens the applicant for some basic information, date of birth, Medicaid number, household size, a couple of things that would impact their ability to get into a unit related to criminal background. And then our system also allows us to ask what type of county what county they want to live in, what bedroom size they need, what particular accommodations they might need in terms of accessibility and things like that. And then so we have a list that we have and that we can sort by county as well as it relates to our priority populations. In terms of the selection process, as units become available, we again go through another screening process with our referrals. This is conducted by our waitlist manager, and we sort by date and time of application, priority status within the priority populations we've identified in our program, and then finally the county in which they want to live, because we match that to where the units that are identified by DHCD become available. Once the person is on our list, there's what we call the wait list period, which is actually a period where a lot of activity needs to occur related to what the case manager or supports planner is doing with their applicant in order to make sure that the person is ready to transition into the unit at the time that it becomes available. So another key role, as I mentioned before, of our waitlist manager is to provide the technical assistance and ongoing contact with the supports planner to make sure that all those things are being done so that the unit can be occupied at the time it becomes available. And we really kind of built our system around trying to make sure that it helped us facilitate our ability to provide that technical assistance, meet the needs of property owners in terms of being able to having a robust list of quality referrals where we could get people into the units quickly. And then finally, and just as important, to make sure that through this process we were collecting the type of data that we would need both to measure our effectiveness and timeliness in terms of the referral process, and also provide the data that that HUD was going to require. So I know I probably haven't covered everything in our system, but the one I did want to just sort of stress what it is that we learned through our process. One is, to the extent that you can develop effective or already have effective partnerships with your partner agencies, both the housing agency, the agencies that provide the services, any property management groups, the development community, the service providers. It's important to develop or maintain those partnerships and invite their input into the development of your system and your application process. We tried to build our application process, can't match it perfectly, but we tried to build it around making sure that we could get people into units or help them get into units in a way that both met the needs of developers who obviously need the units filled when they're vacant, and also helped supports planners facilitate the transition process. The other thing I would stress is make sure that you spend a lot of time thinking about what type of data and reports you're going to want to run, depending on how you use the system. If you're going to be paying an outside vendor to do it, obviously those things can become expensive, especially if you have to modify your system after the fact. So we put a lot of time and effort into, we had weekly calls with various key members of our team to make sure that we had as good a handle as we could have on what type of data we were going to want, and then collect. And then the other thing I would say, and this was mentioned before, is to make sure that you have a good grasp of what your staff capacity is. As people have said in the past, a lot of these things don't occur with one conversation. It takes a lot of ongoing outreach. Especially what we found out is that there's a lot of continuing outreach that needs to take place with the sports planners so that they understand the program, how to refer an applicant, and what support they need to provide along the way, and with the development and property management community as well. So like I said, if you have any questions for me, my email is up there. Feel free to contact me, and I can give you more information. And thanks again for the opportunity.
And you can also put your question into the chat box, and hopefully we'll have a couple of minutes before we go into HUD systems. But Steve Chopek, PHFA, how about you? You want to tell us something about your lessons learned?
Sure. It was mentioned earlier we have 67 counties, and the service delivery systems we learned early on have different capacity levels. We used a local lead agency model where our Department of Human Services, who is our Medicaid agency, I don't work at the Department of Human Services, I'm on the housing side, but they recruited local lead agencies to then assemble a cross-disability sector of stakeholders at local meetings, because we knew there was existing networks throughout those 67 counties of service providers. In the state of Pennsylvania, they call them local housing options teams sometimes, or other service provider networks. And so DHS worked very closely with those local lead agencies to build up their capacity and understanding of Section 811 through a series of webinars that occurred monthly. And we were part of those as they occurred. And we learned as we went on with this decentralized system. Some of our partners, and maybe who had a little more capacity to do something like waitlist management and offer timely referrals to set-aside units, had an existing system that we could use and still meet our reporting obligations to HUD as the grantee. And so we have a decentralized system, and we're using multiple systems to make it work. Stepping back for a second, on the housing side in Pennsylvania, we use a web-based statewide vacancy reporting system, and that system is searchable for individuals across the state who are looking for housing. And so our tax credit property managers are used to that system. We've been using it for several years. And so Section 811 worked out well because this web-based platform that we're going to use at some of the counties within the local lead agencies offers the opportunity to, as the property manager and you have two set-aside units, when you have a vacancy that you anticipate, you can put that into the system, and the system then would work with the local agency virtually via email pop-ups to offer some referrals for those set-aside units. As you might have heard from Holly, who spoke earlier about our Pennsylvania experience, we haven't initiated any rental assistance contracts fully yet, and so a lot of this is in theory. But the lesson learned for us truly was one answer will not work for all of our partners in Pennsylvania who are going to offer referrals. And so we have really been flexible, understanding our reporting requirements and understanding the goal of the program. And I guess that's about it. Lisa?
Thank you so much, Steve. There are a couple of questions in this section that we have so far. I think they may be more for HUD than you guys, but I'll put them out there. Or maybe some of them got answered. So I think this one might be for HUD. How do you place your 811 clients into an existing project when they have their own, when that project has its own waiting list with renters ahead of these folks?
Yeah, hello, this is Danielle. So through the program, something that's very unique as if once you start reading the program guidelines, in regard to waitlist management, PRA has, you're going to be having your own waitlist for your PRA residents. So essentially at a property, if an owner's committing a rack to 10 units, then you would have a separate waitlist for those 10 units. And that waitlist may be centralized or decentralized depending how you're structuring waitlist management within the state. Whatever you decide to do, though, it's important to put that in your tenant selection plan. That way residents who are being referred are aware of how you're managing the waitlist.
Thank you, Danielle. There's a question about, just want to confirm, do you have to use HUD's affirmative marketing form or can you create your own?
Yes, you do have to use the affirmative fair housing marketing plan. You do have to use our form. You can't use an alternative.
Thank you. At this point, I think those are the questions specifically related to this section. If you have additional questions, please continue to provide, send them in, and we'll do them with questions at the end. And if any of them are for Steve or for John and they're still with us, they can answer them then. Thank you both very much for your participation. Danielle?
Thank you, Lisa. And first off, I want to give a big thank you to our friends at Pennsylvania, Maryland, and California for giving us your lessons learned. I think that's going to be very helpful and beneficial to our new states that were awarded under FY13. So just to briefly go into HUD systems, this is going to be our last topic for today. We're going to talk about the multifamily systems that PRA will be using, and we're just going to be looking at it briefly. So if you're not familiar with these systems, don't worry. We will have a more detailed conversation during the convening. And to start off, though, we will be giving you a few polling questions. Now, in regard to the polling questions, these questions are directly directed to the housing folks to answer.
Okay. So I'm going to launch the first poll. And so what we're asking is, which of these statements is true? 1, EIV stands for Environmental Information Verification. 2, EIV is an optional system for use by owners of HUD-assisted housing. 3, EIV verifies employment and income of tenants and reduces administrative and subsidy errors. Or 4, the Social Security Administration, or SSA, and the Department of Health and Human Services, HHS, are not participants in the system. So once again, you want to select the statement that is true. So I'm going to give this poll. We've already received a number of answers. Give it about another 20 seconds. It looks like the answers have stopped coming in. So I'm going to close this poll out, and I'm going to launch the answers. So 3% believe that the first statement, EIV stands for Environmental Information Verification, is correct. 3% believe that EIV is an optional system for use by owners of HUD-assisted housing. And 94% believe that the correct answer is EIV verifies employment and income of tenants and reduces admin and subsidy errors. So I'm going to bring up a slide that shows you that the correct statement was number 3. So EIV verifies employment and income of tenants and reduces administrative and subsidy errors. However, also on the screen, we have corrected the previous statement so that all are correct. So EIV stands for Enterprise Information Verification. EIV is a required system for use by owners of HUD-assisted housing, and SSA and HHS are participants in the system. So we have another poll for you that I'm going to launch. Actually, before that,
okay.
giving it back to Danielle.
Great. Thanks, Stacy. So just to briefly cover the EIV here. So EIV is a web-based program that verifies employment and income of the tenant. It also helps reduce the administrative and subsidy errors that we've seen previously. Information in EIV is derived from a computer matching program initiated by HUD with SSA and HHS. The system uses personal identifiers such as the resident's name, date of birth, social security number, and all of this information is reported on the HUD 500-59. And we will move over to the next polling question.
And now we have another polling question for you. I'm going to open it. And once again, you're going to select the statement that you think is true. So the first option, TRAC stands for Tenant Rental and Computation System. 2, TRACS is a financial management system developed by HUD to improve the fiscal control over housing programs. 3, TRACS is one of many repositories of multifamily housing tenant certification data. 4, TRACS currently controls payment processing for approximately 5,000 Section 8 subsidy payments annually. Or 5, owners who receive Section 811 PRA funds will not have to use TRACS. So once again, looking for the statement that you believe is true. I'm going to leave this poll open for another 20 or 25 seconds. So go ahead and send in those answers. Answers are still coming in, so I'm going to give it another 10 seconds. All right, looks like the answers have slowed down, so I'm going to share the results. 8% believe that TRAC stands for Tenant Rental and Computation System. 54% believe that TRAC is a financial management system developed to improve the fiscal control over housing programs. 23% believe TRAC is one of many repositories of multifamily housing tenant certification data. And 15% believe that TRAC currently controls payment processing for approximately 5,000 Section 8 subsidy annually. So if we turn to the slides again and on your screen, you're going to see that the correct answer was number 2. TRACS is a financial management system developed by HUD to improve the fiscal control over Section 8 and other HUD-assisted housing programs. However, like we did with the last polling question, we've corrected all of these statements so that they read true. So TRACS stands for Tenant Rental Assistance Certification System. TRACS is the sole repository of all tenant certification data, assistance contract data, and crucial payment data for HUD's Office of Multifamily Housing, or MFH. And based on the data stored in the system, TRACS automatically generates payments for subsidy programs where HUD is the contract administrator. TRACS currently controls payment processing for approximately 250,000 Section 8 subsidy payments annually. And owners who receive Section 811 PRA funds will have to use TRACS. I'm going to turn things back over to Danielle.
Great. Thanks, Dee. And just to give you a little background about TRACS, TRACS was developed to help improve financial controls over assisted housing programs. The system collects tenant data that includes personal identifiers, income, expenses, assets, anything that the resident has financially, and then you're going to report that on the 500-59. TRACS also allows HUD to see the subsidy that we're paying per unit and at the property as well, and it is a required multifamily system. Owners are responsible for processing the tenant certifications, which is the 500-59, the tenant recertifications at annual or interim certifications, and subsidy billings using an automated software that conforms with HUD specifications. So if you're a grantee that is a PDCA or TCA, you are familiar with EIV and TRACS, but if you are not, we are going to cover a detailed session on HUD systems at a later date. And just to kind of keep in mind some other HUD systems that we're not going to go over today, but grantees and owners are also required, or rather, grantees are required to have an ELOC. You're going to be using Business Partners website, EIV TRACS we just mentioned, IREMS is a grantee system, and IMAX as well. And this next slide, we covered the basis here regarding the PDCAs, TCAs, and some other options that you can do if you are not familiar with HUD systems is you can subcontract the work related to HUD systems. This may have been discussed in your application. So if you are one of those folks that are going to go that route, I would engage the conversations with those contractors. And here we will turn it over to Lisa for questions. Or if any of you want to do the process of the audio pin, you can also chime in.
I just want to point out that we got several chat box comments that we had a typo on the slides that will be fixed with the final version. EIV stands for Enterprise Income Verification. So that was not a trick question, that was a typo. We do have a question that is more of a segue. This is the only one we have, so if you have anything else, either do your pin or please submit to the chat line quickly. What are HUD's reporting requirements? Danielle, Katina, do you want to talk about that?
Sure. Thanks, Lisa. The reporting requirements are in the cooperative agreement, and we have a reporting tool that we've crafted for the FY12 grantees. We will go over the reporting details in our next webinar next week, but essentially the requirements are quarterly until you're fully ramped up and leased up, and then annual thereafter.
There's another question. Does the last slide cover all the HUD systems that the states will need so that they can use this sort of like an informal RFP? They want to make sure that they are clear on all the work that they have to subcontract out.
Good question. This should cover the list of the systems. We have some savvy folks on the line, obviously, who corrected the typo for EIV. So if you're one of the folks who are very familiar with multifamily systems, shoot me an email if there's any missing from the list, and we could update that in our PowerPoint slide.
Okay. Someone asked when you used the phrase capped preference. Did you mean capping the number of, what did you mean by that? I think we've got slides all over the table here, but I think the way that was used in the tenant selection plan was, do you want to talk about that?
Yeah, okay. Thank you, that's a good question. So if the question was regards to the tenant selection plan having a capped preference of an owner having a preference of a person with disability, so for example, if you are working with an owner who has an existing preference for a person with disabilities of 10%. What that means is as your conversations with the owner would go, even though the PRA has a 25% cap, through statute, the owner cannot exceed that 25%. So what that means is for PRA, you can only get 15% of units at that property. That way total at the property, you're working with a 25% threshold.
Okay, thank you, Danielle. I'm just checking the box for the last time. Rolling down, and I think those are all the questions.
Great. So as Danielle just said a minute ago, our final training session is going to be on April 30th at 3 o'clock Eastern Time, and we're going to cover reporting requirements for the program. But also next week, on April 16th at 3 o'clock Eastern Time, we're going to have our monthly grantee peer-to-peer call for both the fiscal year 12 and fiscal year 13 grantees. If you need registration links to any of those, you can feel free to email TAC or email me and my email address is on the slide. Great. So if there are no other questions, Lisa? Nope. Thanks everyone for participating, and we'll talk to you soon.